Good afternoon, friends, colleagues, excellencies. So glad to see you. Listen, I know it's very warm, so if someone would like to take off their jacket, please don't let me stop you. We know that in WTO now they have a no-tie policy and not to have double standards. I think we can introduce it, at least for this side events, also in the in this building. My name is Tine Smith. I'm the ambassador and permanent representative of Norway here in Geneva. And I must say it's a true pleasure to moderate this event with so many great partners and focusing on a key priority for many of us here today. Thanks to UNFPA and Universal Rights Group for organizing these events, and to Colombia, Costa Rica, Denmark, Kazakhstan, and Malaysia, and OHCHR for their co-sponsorship. The June session of the Human Rights Council is always a very interesting one, as women's rights and gender equality go to the core of human rights. And during the 3 years I have been here in Geneva, the June session have also been the most challenging ones, where a lot of time is spent on debating what progress in women's rights and gender equality actually looks like. I'm therefore very pleased that we in this event are able to present a report that looks at the national level results from the multilateral engagement on women's rights and gender equality and sexual and reproductive health and rights in particular. This links to the results on the ground, and this is a key priority for me and my government. What we do here in Geneva should and must matter to people in local communities and make gender equality and access to SRHR a reality where people are. So I'm therefore pleased that Norway have contributed to funding this work, which hopefully will provide us with useful information for future council sessions and other multilateral efforts. And the title of the report that we are launching today says it all in terms of what we want to achieve: advancing rights, transforming lives. But to what extent do we succeed? What are the lessons from states' implementation of international agreements at national levels? How can we build on this to make our work at multilateral levels more effective and ensure that these efforts have a real impact on people's lives? At this event, we will look at the importance of states' engagement in the human rights system at both international and national levels to bridge the gap between universal values and local realities. And the meeting brings international and national perspectives together, which is essential to fill these gaps. And in our distinguished panel today, we have representatives from 2 of the countries from the case studies, Costa Rica and Kazakhstan, in addition to Mark Lyman from URG, who will present the full report. The full report might be a bit exaggerated, but some
more than 1.5 minutes.
Yeah, highlights of the report. And we also hope that we will have some time for Q&A at the end, and we will monitor the online chat in case there are questions coming from there too. So, but first, it is my true pleasure to give the floor to Monica Farrow. And this is actually Monica's last panel in Geneva after 6.5 years. And I think we've all seen her, and we're now excited. And I don't think I really need to introduce you, but I still will. The director of the UNFPA office here in Geneva. Prior to joining UNFPA, Monica had a 20-year career of public service in Portugal, during which she served as a member of parliament, as Secretary of State for National Defense, a university lecturer, a media personality, and an activist. Monica, you have the floor.
Thank you so much, Ambassador. Thank you for the very kind introduction, and thank you for partnering with us. And in that sense, I want to thank all the missions, all the agencies who've partnered with us, not only on the production of the report, Mark, but also in this specific event. And I want to start by wishing you all happy World Population Day. Today is World Population Day. And the logo or the mantra for this year is what women and girls want matters. And this is what I wanted to start with and invite you, of course, to go and read our statement, because it really highlights on how gender inequality is what is holding women back. And by holding women back, you are actually holding back the possibility to build a more prosperous, a more inclusive, better future for everyone. And also just a note, because if you scan the QR code that you have in the flyers in front of you, you can access the report. So we are even walking the talk on being resource sensible and in this sense. But I wanted to start by saying that 29 years ago, women's rights activists and advocates, they galvanized the political will that led to the Cairo International Conference on Population and Development, the ICPD, and its historic program of action. Many of them were young women fighting to change the status quo and transform people's lives through their unwavering commitment to sexual and reproductive health and rights. As a result of their advocacy, the ICPD reframed population issues from an emphasis on population numbers to an emphasis on human rights. And since 1994 and the ICPD, the UN International Human Rights mechanisms have made huge strides in strengthening the normative and legal framework of the ICPD. Violations of sexual and reproductive health and rights have been established as a form of violence against women, and the right to sexual and reproductive health has been recognized as not only integral to the right to health, but fundamentally linked to the enjoyment of many other human rights, such as the right to education, the right to work, the equality, as well as the right to life, privacy, and freedom from torture and individual autonomy. At the same time as the normative foundation of the ICPD has deepened, UNFPA has been at the forefront on the efforts to translate these international human rights norms into country-level action, and this is what we're going to showcase in this publication. As the ambassador just mentioned, we couldn't ask for a better title. Advancing Rights, Transforming Lives, developed in partnership with the Universal Rights Group, reflects these achievements, and it comes in a critical moment. Today, as we continue our efforts to support women's rights, we are living an era of multiple crises, loss of gains on gender equality, from conflicts to climate crisis, to increasing political polarization over women's rights. As a result, we are still falling short for too many women and girls in all their diversity, particularly those left behind due to intersectional discrimination and pervasive social norms that continue to view women as subordinate to men. In these times, combining our operational reach and expertise with the normative framing and authoritative voice of the human rights mechanisms, treaty bodies, special procedures, the UPR, it really provides us with the powerful force to frame the ICPD vision. We see this in the countless countries we work, some of them documented in this publication, as Mark will guide us through. From our work in Costa Rica to our work in Cote d'Ivoire to Kazakhstan, these findings from the analysis shared with you today, they underscore the important role that the human rights mechanisms play in advancing the 1994 ICPD and its program of action. It also highlights that UNFPA has an important normative role in influencing these mechanisms and, most importantly, in operationalizing human rights norms at the country level. This initiative is part of our overall efforts to support accountability for sexual and reproductive health and rights, and for ending gender-based violence, and to support the normative and operational linkages by strategically engaging with these mechanisms. It also provides us with a valuable roadmap for how we can further build our strategic engagement with the UN human rights mechanisms. And to finalize, as we celebrate the 70th anniversary of the UN Declaration on Human Rights, and as we prepare for next year's ICPD review at 30, this report comes at a critical moment. It underpins the indivisible and interlinked relationship between rights and population issues, and provides us with the evidence and concrete actions required to leverage this mutually reinforcing relationship to ensure the rights and choices of women and girls everywhere. And as Ambassador Smith just mentioned, this is my last panel in Geneva as the head of this office. And these have been 6 wonderful years, and I couldn't be more thankful for your collaboration, your engagement, your passion, your commitment to the ICPD. I think it's also very appropriate that my last panel is on World Population Day during the June session of the Human Rights Council, and also sitting in this panel with so many partners and so many friends, showing what I have told you multiple times throughout these years. Your work matters. Your work does matter for us. It matters for the women and girls we serve. It matters for the populations in vulnerable situations. And if you ever get tired, if you ever wonder if the fights you are having here in Geneva to make sure that the right to health, the right to live a life in larger freedom with all rights and choices, go back to this report and read the many, many ways the work you are doing here in Geneva matters for us. Thank you.
Thank you so much, Director Ferro. And I don't think this is the last panel you will be in Geneva. I have a feeling that you will come back, but thank you so much for providing the context and the history and reminding us that what we're doing is helpful. So it is now my pleasure to give the floor to another one of today's co-sponsors, Hannah Wu, for opening remarks from the OHCHR. And Mrs. Wu is the chief of the Women's Rights and Gender section at the OHCHR. And prior to this role, Mrs. Wu has served as the secretary for the working group on the issue of discrimination against women in law and in practice, and held various positions at OHCHR. You have the floor.
Thank you very much, Ambassador. Distinguished panelists, excellencies, colleagues, and friends, let me begin by congratulating UNFPA and the Universal Rights Group and all those who are involved on behalf of our High Commissioner for Human Rights on the launch of the report on advancing rights and transforming lives. This is indeed a timely and much needed report that addresses the impact of the international human rights system functioning as part of an interrelated, coherent ecosystem on the enjoyment of sexual reproductive health and rights on the ground. As we all know, the effective functioning of the international human rights system relies on the active and meaningful engagement of key stakeholders for inputs and for follow-up on their recommendations. And this report shows the unique role of UNFPA in the field of sexual and reproductive health and rights, linking the international normative guidance with the reality of women and girls' lives. Now, the issue of women's and girls' sexual reproductive health and rights is fundamental for ensuring women's and girls' autonomy to make decisions about their bodies, their sexuality, and their lives. This autonomy lies at the very heart of their universal and fundamental right to equality, privacy, and bodily integrity, and it's critical to the enjoyment of all other human rights, including their capability for equal participation in society. This is the point that Monica also underlined. Sexual reproductive health and rights are not new rights, we all know, and they are embedded in a range of international binding treaties and as part of evolving normative development. They are at the heart of 2030 Agenda and the ICPD Program of Action agreed in Cairo, as just mentioned. They were clearly elaborated in the Beijing Platform of Action, which states that human rights of women include their right to have control over and decide freely and responsibly on matters related to their sexuality, including sexual and reproductive health, free of coercion, discrimination, and violence. And this was almost 30 years ago. It is important that we celebrate progress. At the global level, we see positive changes in the life of women and girls. The availability and use of contraceptives has sharply increased, and comprehensive sexuality education has been progressively introduced in many places. And there has been progress towards the repeal of discriminatory laws that criminalize same-sex consensual contact and safe abortion services. But there are still stark disparities within and between countries. Women and girls from historically marginalized groups, such as those living in poverty with disabilities, or adolescents are in too many cases the least likely to enjoy their sexual and reproductive health and rights. Furthermore, we have been witnessing a wave of gender backlash globally, with women and girls' sexual reproductive health and rights at the forefront, and those who are already marginalized paying the highest price. It is worth reminding us of this unacceptable reality for many women and girls. Every day, about 800 women and girls around the world die. They die from causes related to pregnancy and childbirth. 45% of all abortions are unsafe, and around 214 million women have unmet family planning needs. These facts are not inevitable. They are the result of actions and omissions for which the state is responsible. They are the result of inequality and discrimination. We need to join forces and continue advocating for autonomous, effective, and affordable reproductive rights services, discontinuing the use of criminal law to punish women for ending a pregnancy, dismantling discriminatory barriers to access to termination pregnancy. For girls and adolescents, ensuring their sexual reproductive health and rights, including access to safe and legal abortion, is a matter of ensuring their right to health, their right to education, and a matter of life prospects. Women's sexual and reproductive health and rights are fundamentally about women's role in society. Patriarchal concepts and discriminatory social norms view the role of women and girls essentially restricted to caregiving, reproduction, and the family. And this means that they're often not free to make their own sexual and reproductive choices. Let's restate the fact that sexual reproductive health and rights is central to women's equality, and that women's equality enriches every aspect of culture and society. Contributions from grassroots movements and reproductive rights activists are crucial to the work of the international human rights system. They often face particular risk in the context of rising fundamentalism and need international support, collaboration, and solidarity. In conclusion, sexual reproductive health and rights are fundamental to realizing women's rights, achieving gender equality and their empowerment, and thus creating enabling conditions for their contribution to addressing the multiple global crises confronting humanity and the planet today. And this is why, in the context of the Human Rights 75 celebration, we highlight the interdependence and indivisibility of women's rights in all spheres of life throughout their life cycle. Sexual and reproductive health and rights are fundamental for women's equal participation in public and political life and for their economic empowerment. In the words of the High Commissioner, we will leave no stone unturned to help every society realize gender equality and women's rights. Thank you.
Thank you so much, Mrs. Wu, and thank you for putting out some of the challenges that we see going forward, and also for the role that the OHCHR are playing in meeting those exact challenges. We have now come to the main topic of this event, then, which is the actual report. And it's a pleasure for me to introduce Mark Lyman, who's a very close partner for us. And he's the executive director of the Universal Rights Group, which he founded himself in 2013. And before that, Mark worked as a diplomat at the UN Human Rights Council from 2006 to 2012. And Mark Lyman will now present the report that we are launching. You have the floor, Mark.
Thank you, Ambassador. It's a pleasure to be here to present this report, Advancing Rights, Transforming Lives. As we've heard, a very good title, especially to share the panel with my good friend Monica, last panel, as she said. The Human Rights Council, the human rights system in Geneva, I've always thought it's like the Hotel California. You can check out, but you can never leave. So I'm sure it's not going to be the last time we'll see you, but it's really been a pleasure to work with you and UNFPA on this report, which is super important. I was also chairing an event yesterday where I said that issue, religious intolerance, was super important. But today I really, really, really mean it. Why? For two reasons. Firstly, we're talking about here in this report the real stuff. Okay, I'm not saying the work that diplomats do here in Geneva isn't important, but what's the point of all of this engagement with the mechanisms, here, all these resolutions, guidelines, if it's not being implemented on the ground and if it's not making a real difference in people's lives? And today we're talking about implementation and impact. This is one of those rare things, an effort to actually track implementation of recommendations down to the national level. We also did a similar report with UNICEF, which also had very good results. And then we have applied indicators. So not only can we see if recommendations are being implemented at national level, but then we can actually measure the impact of that on women's rights, and especially in this case, of course, on sexual and reproductive health rights. So the report before you, which I'm honoured to present, does that. It tracks recommendations from Geneva down to national level and looks in detail, and we were only able to do that because we worked with UNFPA country offices, at whether these recommendations are leading to new legislation, new policies, training, new health centres, new amended legislation, and then we're applying indicators. And then we're seeing as well the degree to which the UN country teams are feeding information on implementation impact back into the UN mechanisms so that that can inform future recommendations. So it doesn't sound revolutionary, but it really is revolutionary that anybody has done this, and so we're very pleased to have done it with UNFPA. The report has a number of sections. Firstly, it looks at how implementation is supposed to happen, so the global implementation agenda. Then we look at all of the recommendations from all of the mechanisms related to women's rights, and particularly sexual reproductive health rights, to see the prevalence of those recommendations and what they tend to focus on. Then we present 5 country case studies, and this is the second important and positive part of this meeting. Too often, I think, at the Human Rights Council, we only focus on the negative, countries that are not doing so well on human rights, whereas with this report, we try to celebrate the positives, the success stories, countries that are engaging with the UN human rights system, and then are working with the UN country team, especially UNFPA, to implement that. And so it's important to recognize success as well as point sometimes at the Human Rights Council to failure. And then we also have one global case study on UNFPA's global support system. So the first part, as I said, is the global implementation agenda, how things are supposed to happen. You're all experts here, so you will know this, but states report to the treaty bodies or to the UPR, work slightly differently with special procedures, then they're reviewed, then they receive recommendations, then the idea is then they take those recommendations and they implement them. Too often in the past that's not been the case because they're already thinking about the next report they have to write, so they don't have time to implement. And often in the past, I must say, UN country teams have not been particularly good at using these recommendations to actually work and engage with the state to help them implement. UNFPA is absolutely always been a pioneer in that regard, and I think that shines through in the report. So in terms of looking at all recommendations we analysed under the UPR, we looked at 193 states analysed for the first, second, and most of the third cycles. That included an analysis of over 21,000 recommendations on women's rights, gender equality, and sexual and reproductive health rights. That was actually 24% of all recommendations that we analysed, so it shows the prevalence of recommendations under the UPR on women's rights or gender issues. But of that 24%, only 8% of recommendations were explicitly on sexual and reproductive health rights issues, so a relatively undercooked issue within this broader issue of women's rights, gender equality. Special procedures, we analysed 450 reports by 14 relevant thematic mandate holders, and that included we found there were 3,363 recommendations on women's rights, gender equality, and sexual and reproductive health rights. Again, very prominent. That's 33% of all special procedure recommendations we analysed. But again, of that 33%, only 11%, so a very small number relatively, were focused explicitly on sexual and reproductive health right issues. Then treaty bodies, we reviewed the reports of 21 states over various reporting cycles. That included almost 2,000 recommendations. We found almost 2,000 recommendations on women's rights, gender equality, and sexual and reproductive health rights. But again, only 12% of those recommendations on women's rights, gender equality were focused on sexual and reproductive health right issues. The lesson there, of course, for states, for treaty bodies, and for others is to focus more on delivering recommendations focused on sexual and reproductive health rights. Then the real meat of the report are the case studies. And once again, congratulations to all the countries that were covered in this report. It was really heartening, as Monica mentioned, to see the level of engagement in these countries with the mechanisms, but also with UNFPA and UN country teams. And the case studies all show real impact on people's lives. Going back to the title, Advancing Rights, Transforming Lives, really changing people's lives, even in very difficult national contexts, and even on very difficult or sensitive sexual and reproductive health rights issues. The first case study was Costa Rica. Good to see lots of people from Costa Rica here. And this looked at recommendations received by Costa Rica on the incidence of obstetric violence. And again, we saw impact, deepened legal and medical recognition of the mistreatment or discrimination during childbirth from a human rights perspective in Costa Rica. And in the report, there are lots of examples of what has happened within government, within civil society that's been generated by the recommendations received. We also found that UNFPA, of course, played an important role in Costa Rica, both by drawing attention to this emerging or neglected somewhat human rights issue. This is a relatively new, well, it's not a new issue, but newly recognized issue in many parts of the world, including in Costa Rica, and UNFPA were essential in drawing attention to this important issue. And then UNFPA also worked with Costa Rica on using engagement with the UN mechanisms to mobilize civil society to also draw attention. Secondly, Côte d'Ivoire. Here we looked at recommendations on preventing and combating female genital mutilation. As I said, even in national situations where an issue can be culturally or otherwise sensitive, we were able to show that the steady work of the mechanisms with UNFPA support, we've been able in Côte d'Ivoire to make progress. In particularly in Côte d'Ivoire, in terms of shifting societal attitudes and perceptions about this harmful practice, and then working with the state to really make progress through law and practice and policy in trying to eliminate female genital mutilation. Again, UNFPA, as the case study shows, played a key role both in working and helping the government strengthen laws, but the case study really shows that laws are not enough. You really need to go and really work at the community level, the local level, to change people's perceptions about female genital mutilation. And UNFPA and the wider UN country team have been centrally involved in that. The next case study was Kazakhstan, which looked at youth-friendly sexual and reproductive health services. And again, we found that Kazakhstan, using its engagement with the mechanisms and working with UNFPA and others, has really been able to strengthen its support for adolescent sexual and reproductive health, especially through youth-friendly health centers in Kazakhstan, which have gone from a relatively small number of youth-friendly health centers to now centers across the country. And they've become much more elaborate and sophisticated in terms of the range of services that they're providing to youths and adolescents. And again, UNFPA worked very closely with the government to build awareness about sexual and reproductive health services, especially for adolescents and youths, and working with the government to implement recommendations. And UNFPA were very active in data collection to actually measure the impact of all of this. Next case study was the Maldives, where we looked at comprehensive sexuality education and access to sexual and reproductive health rights information for youths. Again, sensitive subject nationally previously. But UNFPA, by again working with the government, it's one of the great things about working with the UN human rights mechanisms is instead of outsiders going into the Maldives and saying, you need to do this, you need to do that, the work of the mechanisms is based on the input from the Maldives itself, the national reports, stakeholder, civil society reports. And so then the country has somewhat, especially in the UPR, has ownership of the recommendations that come out of the mechanisms. And so then they're more likely and more happy to then work with bilateral donors or with UNFPA or others to say, yes, you know, even on these sensitive issues, we can take forward the recommendations, implement them and secure impact. And we saw that in the Maldives, practical action on comprehensive sexuality education, both inside and outside of the school systems was found in the case study. And the Maldives state itself has done a lot to implement its obligations related to comprehensive sexuality education, oftentimes in partnership with UNFPA, and especially in the Maldives by integrating these recommendations into what used to be called the UN Development Assistance Frameworks, now is the UN Sustainable Development Cooperation Frameworks, basically the agreement between the UN and the government on development programming. So lastly, conclusions and recommendations. I've spoken too long, so I'll rattle through these. The UN Human Rights System first. The UN Human Rights System works because it's, as I mentioned, premised on the full involvement and engagement of states. Close cooperation between UNFPA and governments, the case study shows, is critically important and results in real impact. The UN human rights system can have such an impact even in culturally or socially sensitive topics in a given national context. Implementation, when it works best, it should be pursued as a democratic rather than a bureaucratic process involving parliamentarians, the judiciary, the different ministries and civil society. And drawing attention to the human rights implications of harmful practices and awareness raising and education campaigns, in many of the cases we looked at, really are a critical component going alongside legal and other reforms. And I will stop there, Ambassador. Thank you very much.
Thank you so much, Mark, and big congratulations to Universal Rights Group for this report. This really shows that by going down into exactly what happens, what are the gaps, how can we work on implementation, it will be useful in these countries, but also everywhere else where we try to make sure that we live after the conventions that we have ratified, and also to make sure that people have the necessary rights. So I don't want to lose more time before we go into some of the country cases. I think that's it's quite unique that we have representatives of the countries that have worked on this here in the panel. And let me start with Costa Rica. Ambassador Shara Duncan Villalobos, who prior to her appointment in Geneva served as a legal advisor at the Permanent Mission of Costa Rica in New York, and also held various positions at the Foreign Ministry of Costa Rica. Shara, you have the floor.
Thank you very much for giving me the floor. Also, thank you very much for allowing me to take off my jacket because it's absolutely warm in here and it's impossible. 37 degrees, this is a human rights issue that we're actually able to be, you know, sleeveless.
Just
Please. So we're very happy to be in this panel today and to have the opportunity to talk about our experience and to share with you the experience of Costa Rica in ensuring the national implementation of human rights recommendations. I would like to use this opportunity to make reference to the case study that features my country's advancement of sexual and reproductive health and rights, specifically on obstetric violence. This is still to this day one of the biggest challenges we face in SRHR, and we understand obstetric violence as the mistreatment of and discrimination against women experienced during facility-based childbirth and in other reproductive health services. I think it's important to actually tell you that why do we say facility-based childbirth in Costa Rica the vast majority of births happen actually in facilities, in hospitals. There's very few women that would actually have their children at home. Very, very few. So that's why this is important, that this has so much impact. In recent years, the issue of obstetric violence has received more attention following a ruling by the Constitutional Chamber of the Supreme Court in 2015, by which they recognized this kind of violence as gender violence and a violation of human rights of women and pregnant women, recognizing that none of them should be injured or assaulted or be a victim of mental or moral damage that makes it difficult to preserve their psychological or emotional stability, and recognizing the dignity of women and pregnant women who are in pregnancy, childbirth, or postpartum. According to the study of UNFPA, 57.7% of women of reproductive age who had given birth between 2016 and 18 in Costa Rica reported experiencing some form of obstetric violence during childbirth. From these alarming data, La Defensoría de la Mujer is the women's rights ombudsperson that is part of our national human rights institution, decided to take a two-pronged approach to advocating for the reproductive rights of women and girls. First, it would seek to leverage the country's engagement with the United Nations human rights mechanisms, particularly with CEDAW, to support progress, improved implementation of the state's international human rights obligations and commitments. And the second, it would seek to democratize implementation by promoting an inclusive process of national consultations with civil society about women's rights and particularly about SRHR. In 2015, the Ombudsperson's Office conducted an investigation into complaints of obstetric violence during childbirth. The investigation concluded with a report documenting the causes and human rights consequences of such violence and extended a series of recommendations to the government. And this is where strategic engagement with international human rights mechanisms, especially the treaty bodies, helps the efforts to raise the profile of the problem. It also helped to facilitate a process of national dialogue and consultation, including with civil society. The engagement of the Office of the Ombudsperson brought data, evidence, and the human rights dimension to the fore. And in this sense, UNFPA has played a key role in drawing attention to and driving domestic progress by contributing with information, data, and practical suggestions into review, implementation, and reporting cycles with the treaty bodies and the UPR, as well as through its own engagement with the special procedures. Over a 2-year period, the partners organized 5 consultations with more than 70 women's rights organizations. 3 consultations were with women's rights organizations, and 2 of the consultations were with representatives of marginalized groups, often most at risk of obstetric violence, such as indigenous and Afro-descendant women and women with disabilities. The consultation process resulted in a plan of action known as the Women's Agenda. And it was a groundbreaking effort to mobilize civil society to help inform national debates about SRHR issues and to promote civil society's participation in the processes of implementing the CEDAW's 2017 recommendations. The Women's Agenda and the related mobilization of civil society contributed to important positive results. It applied a bottom-up approach premised on influencing domestic debate, informing and educating right holders first and duty bearers, thereby building public support for the implementation of the country's international human rights obligations and commitments. In July 2017, the Office of the Ombudsperson, together with Costa Rican civil society organizations and UNFPA, presented the Women's Agenda to Parliament and relevant government ministries. This actually helped inform lawmakers and build pressure on the executive and legislative branches to take action to implement the CEDAW's recommendations. In the country's 2020 follow-up report to the CEDAW Committee's 2017 concluding observations, the state provided a long list of measures taken to implement the committee's recommendations on obstetric violence. These measures included steps taken to raise awareness among and deliver training for health personnel in the country's maternity wards, the definition of a clinical protocol for pregnancy, childbirth, and postpartum care known as the Law on Humanized Birth, which entered into force in February 2020, and rolling out national information campaigns about women's rights in the context of prenatal, childbirth, and postnatal care. This case offers a key lesson on the implementation of human rights recommendations. It actually emphasizes the importance of leveraging the active and meaningful participation of civil society networks and women's rights groups, as well as engaging with national human rights institutions to help inform rights holders, healthcare providers, and policymakers. On January 13, 2022, Law 10,081 was approved and is called the Women's Rights During the Qualified, Dignified, and Respectful Care of Pregnancy, Childbirth, Postpartum, and Newborn Care. And this is a milestone in terms of guaranteeing the human rights of pregnant women in the country and those who are part of the pregnant families to achieve a pregnancy, childbirth, and postpartum and puerperium with qualified and humanized care. Its current regulation process will allow the homogenization of the quality of the service and will provide the possibility of correct follow-up of its applications in all maternity wards in the country, both in private and public health services. There is still a long way to go to guarantee women's rights to comprehensive health care, but with the help of the universal system and its mechanisms and the UN and its agencies, such as UNFPA, we're moving in the right direction. Thank you.
Thank you so much, Excellency. And I just want to focus on what you said about strategic engagement to solve a problem and how your consultative approach has brought all affected to the table, and then you've used the system to gain results. So congratulations, very interesting. Let me then move to another country case, which is Kazakhstan. Excellency Ambassador Alimbayev, and we'll be very interested to hear your perspectives on this study and report. And Ambassador Yerlan Alimbayev have been here since January 2022? Yes. Yeah, last year. And prior to his appointment in Geneva, he served as Deputy Minister of Foreign Affairs and also held various positions at Kazakhstan's different embassies around the world. Ambassador, you have the floor.
Thank you, Ambassador Smith. So it's my real pleasure to be present. So first of all, I would like to warmly welcome and thank our distinguished speakers for joining us this afternoon for sharing their inspiring and valuable insights, as well as raising awareness on these very important issues. So as we recognize the 75th anniversary of the Universal Declaration of Human Rights this year, Kazakhstan remains committed to the promotion of human rights. To this end, my government has taken and will continue further steps towards the realization of all human rights, including to the enjoyment of the highest attainable standards of health. Kazakhstan welcomes this initiative to document experiences and good and best practices in implementing human rights recommendations through development cooperation. Human rights mechanisms, including the UPR, are driven by a principle of constructive and cooperative engagement between member states and the development cooperation actors. In order to advance the full realization of human rights. And the publication, what we see of this report illustrates states' commitment to uphold human rights obligations and jointly work with UNFPA and other UN agencies in integrating recommendations from human rights mechanisms in country program documents. Can better promote, respect, and protect human rights, in particular of persons in vulnerable situations. Our case illustrates how human rights recommendations have contributed to deepen and guide government action to support adolescent sexual and reproductive health through the design and scaling up of youth-friendly sexual and reproductive health services across the country. Over the last few years, UN human rights mechanisms have helped to bring attention to and strengthen adolescents and youth access to sexual and reproductive health services, including in my country. For example, in 2014, CEDAW committee recommended Kazakhstan to ensure free access by women, including in rural areas, women with disabilities and adolescents to contraceptives by adding them to the list of state-guaranteed free medical services and medicines. Following this recommendation, my government developed a family planning national framework program asserting, I quote, access for adolescents and young people to comprehensive sexuality education and youth-friendly services as a primary objective and a guiding principle. In 2019, at the third UPR review, my country informed the Human Rights Council that by then 96 youth health centers were operating in the country to, I quote, provide family counseling, protect reproductive health of young people, and educate young people on prevention of unwanted pregnancies and abortions. This work was carried out by Kazakhstan's government with the help of UNFPA and technical assistance. In 2019, again, CEDAW committee recommended to improve the quality and the accessibility of health services provided by health centers for young people, including by strengthening the skills and capacity of the staff to deliver gender-sensitive and youth-friendly services and guarantee confidentiality and privacy. So further, in order to implement this recommendation, government of Kazakhstan has taken these steps. Ministry of Healthcare developed a strategy with the support of UNFPA again to improve the quality and the accessibility of health services by transforming the youth health centers into youth-friendly health centers, as was mentioned by a previous speaker. And the second, Minister of Healthcare developed a sustainable development strategy and a series of clinical protocols governing the ways in which the centers deal with the most common challenges related to the reproductive health of adolescents and the provision of psychological and legal counseling. On the legislative part, the new Code on Health and the Population and the Health Care System was publicly debated and entered into force in the following year, in 2020. It includes a whole chapter dedicated to adolescent and youth health, an article that effectively reduces the legal age for accessing outpatient health services without parental consent from 18 years to 16. It includes except abortion, surgical procedures, and inpatient care. And it also has an article enshrining the right of minors to receive information on reproductive health. All these experiences illustrate that the fact that constructive and collaborative engagement of the states with international human rights mechanisms and the development cooperation actors on the ground, such as UNFPA, can decisively contribute to make remarkable strides in the progressive realization of economic, social, and cultural rights of human. We hope that our case study will inspire other states and UN agencies and different development actors to seek similar avenues of cooperation for better life of people and well-being of population. So again, I'd like to thank you, all of you, and Ambassador Smith, back to you.
Thank you. Thank you so much, Excellency, for sharing the experiences that your country have made in following up recommendations and implementing this on the ground and in your policies. So, not unusual for a side event. We are a bit short on time. Are there anyone waiting for us outside? Lena, are there anyone waiting? Okay, so we'll give ourselves just a couple of minutes. Yeah, okay, couple of minutes, which means. Yeah. We'll just stay on for Monica's last side event. No, but I wanted to just make sure that we use the opportunity of opening up for just a couple of questions. And are there anyone from the online participants? No? Okay, so to the room. Do we have any questions and comments? Just one or two? Arlen, you have the floor.
Thank you. And apologies, I haven't read the report, but I do have the flyer, so will do. I think it's really interesting to hear directly the experience from the ground. Often when we're here in the room and we're talking about the rights of women and girls and sexual and reproductive health rights, we don't often link it to the experience on the ground. And it's clear that the work that you're doing is having very tangible impact for women and girls in your countries. And I just wonder, what advice do you have to better link that practical experience? We all know that working on sexual reproductive health and rights, investing in education, investing in women has massive dividends for a country. So how do we link that to the conversations that we're having here, where we're seeing some of those rights challenged on a daily basis? Thanks.
Thank you so much. And is there one more question? I don't see anyone. I think your question is excellent. So I think that it's a useful way of just going quickly back to the panel to ask all of you for a short comment, all of the speakers so far, on the link between your practical experiences and the work we're doing here. So I think I will start with the two country cases. I will start with you, Ambassador Shara. You have the floor. 30 seconds.
Okay, in 30 seconds, I think it's very, very important, and Costa Rica is very appreciative when we receive the UPR recommendations. So that's something that we can do that is linked to what we states do, and it actually has a practical impact on people's lives. If it was not for the UPR recommendations, we would not have our policy on racial discrimination. We would not be giving, on sexual health and reproductive rights, we would not be giving girls contraceptives free without having to have the consent of their parents. We would not be doing so many things, and we would still be, blindfolded when it comes to obstetric violence. So I think that just have those recommendations come along, please. That actually affects people on the ground.
Excellent. Thank you so much, Ambassador Yelan.
Yeah, I agree with my colleagues. So we already have such good mechanisms as UPR and our committees, reports, examinations, and etc. And as I mentioned, in our case, it's we already, as I said, had excellent experience and good examples. And in our case, as I said, we again, communication and feedback and engagement between all actors, including, of course, member states and all UN mechanisms are very crucial.
Thank you so much. OHCHR, Mrs. Wu.
Thank you. Just to say that the international human rights system, it's very complex, and there's so much that serves as a solid basis for us in terms of normative work on sexual reproductive health and rights, and that continues evolving. So it's a good for us to always turn to that as a basis and a framework. And then second point is about how to see the sexual reproductive health rights is not only right to equality, also it's essential to face the challenges of the global challenges of today. Thank you.
Thank you so much. Mark?
Earlier I think I had 9 conclusions up, but I could have just said one, and that is, this is one of the reasons I really like this report, having worked here in Geneva for 15 years. It really shows that the UN human rights system works. The work of the mechanisms based on the instruments and the guidelines, the norms, it really works. Why does it work? Because it's based on cooperation with the state. And this goes to answer the question from Ireland. It's not about people coming from outside and imposing anything. It's about the states that have signed and ratified the treaties. Then they've worked, they've reported to the treaty bodies, they've appeared before the treaty bodies, they've received the recommendations. Same with the UPR. Special procedures, they've received voluntarily received visits and therefore again have ownership. The human rights pillar, even though some people would like if it did, doesn't have the power to force a country to do what it doesn't want to do. Where it does work, both the council and the mechanisms, is when states come forward and voluntarily engage and sign the treaties and want to work with it, because as I said earlier, then they feel a sense of ownership. So my response to Ireland and also all states would be to really use this this cycle, the reporting, review, implementation cycle, and make sure that that cycle, especially the work that's done at national level, is inclusive. So it involves civil society, involves parliamentarians, involves the judiciary, and is really a democratic process rather than a bureaucratic process. Thanks, Simon.
Thank you so much, Mark. And it's my pleasure to give the floor to Director Monica Farrow. The last time I'm doing that for now.
Thank you. I'm gonna break protocol in many ways, because this report is about how the work we all do here in Geneva impacts the life of people in the field, and this is what we really wanted. We wanted to remind you all why you are here and why these conversations are important. And we wanted to, but we also wanted to, as Mark said, to give visibility to some good cases, some good results, to inspire others, because that's how you promote human rights. It's by showing, it's by leading, it's then following up with technical cooperation. And this was the reason why this report was so important for us, UNFPA, and Alfonso, thank you. You worked so hard on this report to get it done, and thank you for the rest of our team, and thank you, Mark, to your team. And this is when I'm going to break protocol. I'm not the only one leaving. The Ambassador Smith is leaving too. And we were so keen on doing this before we left, because we really wanted to be able to sit in front of you and say, listen, this is why we partner. This is why the UN system exists. It's in order to make all these rights, all these beautiful conversations that happen in Geneva, in New York, wherever, how we translate this into practical issues, into transforming lives. And I think that this for us was very important. We wanted to leave Geneva with a sense of, at least we've accomplished some things, and this is the record we want to set. Sorry for having violated your privacy, but I wanted also that to be very clear that this is a result of the joint work, and thank you, Tine, for always being in our back, asking us to show you how the work we do here in Geneva matters for all of you. Thank you.
Thank you so much. And let me now introduce our final speaker for today, Deputy Permanent Representative Rina Hannes Rodsli, who is from the mission of Malaysia to the UN here in Geneva. She has been director of the ASEAN Political Security Community Division at the ASEAN Malaysia National Secretariat, and also held various positions at Malaysia's embassies and Ministry of Foreign Affairs. Rina, you have the floor.
Thank you so much, Ambassador. I wish to join others in thanking the organizers, UNFPA and URG, for producing this important and timely report. We welcome the effort in the report to show how strategic engagement can bring about real changes in laws, policies, and institutions, and ultimately in people's lives. I'm also honored to be given the opportunity to share how the collaboration and strategic engagements between the Malaysian government and the UN agencies, in particular UNFPA, have helped us in the implementation of programs to advance sexual and reproductive health and rights in the country. So Malaysia regards the UPR as a crucial platform to promote and protect human rights and fundamental freedom in a constructive and collaborative way. We are the first country to establish the National Recommendations Tracking Database 2.0 developed by the OHHR to improve its monitoring mechanisms on UPR, treaty bodies, and special procedures recommendations. We have taken a whole-of-nation approach and institutionalized a multi-stakeholder biennial consultation, including with UN agencies to follow up on the recommendations received. The report by UNFPA on enhancing human capital and macroeconomic performance through sexual and reproductive health investments in Malaysia shows how investments in sexual and reproductive health and rights integrated with related family support policies could actually increase female labor force participation and productivity and increase socio-economic well-being. So our government loves the report so much because of the return of investment, because it has provided evidence and grounds for the government to invest more in sexual and reproductive health. In turn, from 2017 to 2021, approximately 1.9 million family members received various reproductive health services such as family planning, mammogram screening, HPV vaccination, and pap smear through 49 public clinics, as well as 15 family mobile centers to reach out to target groups, especially those in rural and hard-to-reach communities. During the third UPR, Malaysia received 28 SRHR-related recommendations. So what do we do with these recommendations? We team up with UNFPA through our country program action plan, which has been instrumental in supporting the implementation to translate those recommendations into implementation. So I wish to highlight two specific implementation that we've had. First, on sexual and reproductive health education. Malaysia has launched this sexual and reproductive health education since September 2022 for implementation up until 2025. It provides important insights to enhance the effectiveness of sexual and reproductive health education in both formal and informal settings. We have utilized the findings from research carried out by our Ministry of Women and UNFPA back in 2015 to develop intervention programs for addressing low awareness on reproductive health among adolescents. Notably, the introduction of sexual and reproductive health module for boys aged 16 to 24 years in 2016, because yes, boys are also responsible in reproduction. So this module conducted in an interactive form using various learning methods such as role play, sketches, group work. Since inception, a total of 1,046 boys have undergone this module. Second, Malaysia is also taking necessary steps to address teenage pregnancies. The 2021 scoping review conducted by our Ministry of Health, guided by WHO Adolescent SRH framework, underlined the need for more data on our SRH-related knowledge, attitude, perception, and practice. Therefore, the government is looking into re-evaluating and strengthening various SRH intervention strategies that are evidence-based, culturally appropriate, and adolescent-friendly to better address this issue. So finally, ladies and gentlemen, the international community has developed an extensive normative framework over the last decades. We now have entered implementation era, so that recognition of human rights norms and standards translate into tangible changes for people on the ground. Malaysia too hope that current endeavours we are undertaking will propel the country in achieving 2030 agenda and SDGs, including we strongly encourage governments and UN human rights and development entities to continue collaborating in documenting these experiences, as well as draw lessons from knowledge and capacity sharing initiatives. Thank you.
Thank you so much. I think we've overstayed in the room, but I just want to thank you and wish that we can continue this good work. Enjoy the rest of the afternoon, and thank you so much for attending today. And thank you for that. And happy International Population Day to all.